And welcome to this episode of the Good Citizen Podcast. It's my honor today to have Director Terry Stigdon from the Indiana Department of Child Services with me this morning. Director, how are you doing?
I'm doing well, Josh. Thank you very much for having me.
I've been looking forward to this interview for a long time. One of the big questions that we ask on the podcast is, what can we do now? I think many Christians recognize the foster care crisis in their state, certainly here in the state of Indiana. And what I'm looking forward to today is just hearing from you. How can churches in the state of Indiana get involved? We recognize the institutional separation between church and state, but there's a lot of space there. We often say church and state should be partners, not opponents. There's a lot of space there, I think, where we can work together to serve the kids in the state of Indiana. So I wanted to just jump in, ask a little bit about you and what led you to the Department of Child Services. I know that you served as a nurse for a time, and so we'd love to learn a little bit more about your background.
Sure, yeah. I'm a nurse, and most of my nursing experience was at Riley Hospital for Children in Indianapolis. I was there for just shy of 20 years. I worked in the intensive care unit and in the emergency department, all pediatrics. And in both areas, I also served in leadership. I was a manager in the Peds ICU and was a manager and the director over the emergency department at Riley. While at the emergency department, I also became a member of the national organization for emergency nurses called ENA, Emergency Nurses America, and Emergency Nurses Association. And that's really where I got a little bit of a taste of leadership outside of a unit or department or a hospital. So I was a local leader first of the Indianapolis chapter of ENA. And then a couple years later, I was voted in to be the state president, which was quite eye-opening. And I think a lot of the lessons that I learned there really helped prepare me for this job. Of course, I didn't know it at the moment, but looking back, I can see how that was helpful. And then I had the opportunity to serve at a national level by being one of the editors of the latest version of the emergency nursing pediatric course textbook, and serving on committees as well to help impact emergency nursing around the country. I also served on a general assembly of emergency nurses. Every year they meet and go over what type of policy do emergency nurses really need to be aware of? What do we need to make sure that Congress is aware of the needs of not just emergency nurses, but primarily from the perspective of serving patients better? It's really funny to look back on all of my experience as a nurse coming here, that all of it was done, I think, to prepare me for this job. So now I was appointed as the director of DCS, and I answer that call. And so I also do work as a nurse, super part-time every week to help out with the nursing shortage during the pandemic.
You were appointed by Governor Holcomb, I think it was in the beginning of 2018. Is that correct?
Yep, January 22nd, 2018.
And so what led you to go from it sounds like a very, very successful career in nursing, and there certainly would be medical elements in DCS as well, but what led to that pivot? How did you feel led to jump over there?
Difficult to explain to anyone that doesn't know me or doesn't know really how I rely on my faith. But I got a phone call. I got a phone call from one of my favorite physicians in the emergency department at Riley, who also happens to be the secretary of FSSA, Dr. Jennifer Sullivan. And she called me and asked if it was okay for her to give my phone number to someone to talk about an opportunity in state government. And she and I had spoken, 4 months prior to when she called me, because she still works in the ER. We had talked about working in government, and I said, oh my gosh, I'd never do that. I love it here. I'll never go anywhere. But circumstances being what they were, I was open to taking that call, and the rest is history.
And it's one of those calls, and you have to just really trust your friend, right? Because it's like, okay, what position are you going to be putting me up for here? And so
Yep.
I- I'm grateful that you answered that call. I know that when you took the office, and I'm on this podcast, I'm not really here to throw tomatoes at anybody, but I know that there were definitely some challenges in the foster care space. Indiana was ranked pretty poorly nationally on the number of calls related to abuse and neglect. Some of the numbers, and I'll share some of the now positive numbers. But I'd just be interested as you come over from your nursing career into DCS, just that first morning. I can't even imagine. Just looking at all the problems. What were some of those key challenges as you took up the mantle of leadership there?
Um, yeah, so I would say overall, walking in that first day and before I even started, um, the agency had gone through a pretty major public shaming. That's how they felt. And I would say my first objective was to figure out where we really were in that, how were people really feeling, and what could I do to support them. I did have the opportunity to meet with the executive team 2 weeks, I think it was about 2 weeks before I started, just to introduce myself to them because I knew they would be very nervous whenever there's a change in leadership. The next leader is down, of course, are afraid that they may not be able to stay. And so I just wanted to introduce myself and get to know them, just to have some idea before I walked in. But there was a lot of fear. I mean, fear led decisions in the organization. Yeah, people were afraid of um, ending up in a news story. People were afraid of getting fired. People were afraid of making decisions. And you really can't help people well if the people that are supposed to serve are constantly afraid. And so I would say that was my major obstacle, was to figure out what was the root of that fear and what could I do to really get in there and try to get rid of that fear, really address it honestly and transparently, and let people know that I was there for them, that there were things that we needed to do, and if they couldn't be on board, that's fine. We all have choices in life. I would no hard feelings. It's okay if you need to move on, but this is what we need to do, and best wishes to you. And we're just going to keep moving forward.
That's helpful. And as I was preparing for the interview this morning, I was thinking there's certainly the foster care aspect of this and how things have turned around. But I think the leadership lessons that you're sharing would be applicable to really any situation, even church leaders that are listening that are perhaps trying to revitalize a church or change the culture of a church. So that's really helpful. Um, you've shared with me a very helpful story about going upstream, and you may be tired of telling this story when when we talk, but I find it so helpful in looking at this space and this issue. So, would you share that story about going upstream with the listeners?
Sure. And I always like to give credit where credit is due. I am not nearly creative enough to come up with this on my own, but I heard this story at a Prevent Child Abuse America event, and it stuck with me because it made sense. So the story about going upstream, it's a story about a carpenter who worked very hard, and he needed to take a break. So he sat down by the riverbed to relax and enjoy the sun and listen to the water run over the rocks. And he and his trusty hammer were relaxing, not for very long, when he heard cries, screams of a child. And he looked up and out and found that a child was floating down the river. And so, to prevent that child from drowning, he and his trusty hammer on his hip jumped into the river to save the child. Now, that was exhausting, but he was thrilled that he had gotten that child out of the water. The child was now safe and on the riverbed. Then he heard another child. So he swam out to save that child. Then he heard more children. And as he's saving these children, people are noticing and they're coming around and they're helping him, jumping in. Everyone's jumping in, saving the children out of the water. And so as these children are sitting on the side of the river, he's thinking, gosh, where are all these children coming from? Is there anything we can do to stop them from drowning in this river? And so he and his trusty hammer go ahead and they walk upstream, and he finds a village. And the village has buildings that are in disrepair. and there's a strong wind and the fence is broken. And what happens is the children are getting blown over the broken fence, through the broken fence and into the water, into the river, and they're drowning and they're being rescued downstream. And he thought, what if I could help them fix these homes and show them how to do that and help them fix this fence so that the children don't fall in the river. And the people from the village came around and they just didn't know what to do. They lived there and they wanted to make it better, but they just didn't know how. And so this carpenter and his trusty hammer helped them with this is how you repair your houses. He showed them, and this is how you repair the fence. And he saved children from falling in the river and drowning. And so going upstream means going ahead and preventing kids from being in danger. And so that's how I approach this work is how can we go upstream in child welfare instead of helping once kids are removed from their homes and in foster care? Is there something we can do to help them in their homes and prevent them from having to leave their families?
I just think it's a great story and a great way to think about it, especially as it relates to churches and where they're probably best equipped to assist in this area. I did want to go ahead and share just some of the numbers so listeners know just the remarkable turnaround and why I think your work, what's going on here in Indiana, can be an example other places around the country. Governor Holcomb shared some of these stats in the 2021 State of the State address. He said the total number of Department of Child Services cases has decreased by over 30%. The rate of children entering care has decreased by nearly 34%, and turnover at the agency has decreased by 30%. And so certainly the things that you've been working on are working. And after a meeting a few weeks ago, you shared with me kind of a list of things that you thought churches could kind of jump in and help with and or should be aware of. And so I'd love to just capture kind of that list. What are some of the key things that churches can do to help DCS go upstream and help in this issue?
Sure. I believe I gave you a list of 4 things.
That's great.
And I started out with primary prevention. So keep in mind that the way I think about this isn't unique to child welfare. This is how we think about healthcare. Really, what can you do to decrease the chance of comorbidities and prevent people from needing surgeries or needing emergency treatment? And so applying that to child welfare, which there are plenty of people in the child welfare space that think that way, we start with primary prevention. What can you do to prevent children from even having to be known by the system? And it's helping their families and being available in the families. So how can we build up communities and strengthen families? Being a parent's hard. Anyone that's been a parent knows that. And being a parent alone is nearly impossible. Everyone needs help to be a parent. And so when you think about the families that we interact with, a lot of them, what they have in common is being isolated and not really knowing who to go to for help. And so if they knew where to go to in their community and prevent stressors from occurring that lead to neglect and abuse, many cases of abuse, then what can we do in the community? So we have an organization called Community Partners. These are providers that we partially fund. They're also funded by other grants and philanthropic dollars to give families whatever they need. Sometimes they provide classes. Sometimes it's more concrete supports like diapers or formula or furniture or bedding, helping with rent assistance, things like that. But the way the church could help in primary prevention is really being willing to get out there and meet families. I get it that we're in America and people should be able to get to church, but the reality is that is not the America that everyone experiences. And we meet people all the time that don't have reliable transportation. But if they knew about events, or if there was some type of mobile response, something that they could walk to or ride a bike to or something like that, then they would be more aware of what was going on. And they're shift workers also as well, or they might work night shift. And so getting up and going to church on Sunday morning means that they may not be able to know anyone in the church. And so I would say for primary prevention, offer opportunities to provide concrete assistance like bedding, food, clothing, formula, diapers, things like that. But to get out there and to meet people in the community, have opportunities for the community to get to know you. because that's the best way to keep the community wrapped around families. When I get to secondary prevention, it is focused on once we know about this child that's in need, is there any way to prevent them from having to be removed from their family? And so secondary prevention would be preventing them from entering foster care if possible. So we ask the question, what would it take to keep this child safe at home, even if the family needs some additional supports in place? And so looking at it from that perspective, the church can also step in as well, because we have ways of reaching out to churches and saying, hey, you know what, this family just needs a bed. Do you have someone in your congregation that can provide these kids some twin beds so that they have a place to sleep? That would be great. Or can you connect them with a mentor or something like that? Because we don't want families to have to rely on the government to get help that they could be getting in their communities. It would be fantastic for families to be able to thrive within their own communities without the intrusive interventions of the DCS agency. And then another area I mentioned was foster care, which I think the churches are the most familiar with, is in foster care. So once a child is removed from their families, it is traumatic. And no matter how wonderful the family is that they're going to, even if they're going to their own family where they relatives or kin, it's traumatic because they're leaving what they know. So churches being able to wrap around those that support children in foster care would be fantastic. We have traditional foster care, with which I think that everyone's familiar with, but then there's also relative care, which are family members that step up and say, I will take care of this family member because I want to keep them with people that they know. They need help too. And unfortunately, the government response to supporting the families differ a little bit right now around the nation. But there is a movement federally to shore that up and even that up from a governmental perspective. So I'm excited about that. But the churches, I'm sure you all know, I'm sure we have pastors all over that know those grandparents or those aunts and uncles that are taking care of
Yeah.
family members.
Yeah.
They may or may not be involved with DCS, but they would have needs, and so let's do what we can to support them. And then the last is our older youth. These are young adults that have lived in the foster care system. They're now over the age of 18 and may still be receiving services from DCS, but they have no legal ties to family. And so being there for them to help them have those healthy relationships and connections with adults is critical for their well-being and their growth into adulthood. So be open to wrapping around those young adults and helping them know that they're not alone and that they have support in their communities.
These are all excellent. There's a few things I wanted to emphasize. You mentioned when you came in that there was a bit of a spirit of fear. Maybe just the morale was poor. And as I've been speaking with DCS workers, sometimes they're even reluctant to tell people what they do. And there can be that kind of stigma about social work. So I wanted to focus in on just an amazing stat that you shared with us about family preservation services here in the state of Indiana. For those that are listening, may be familiar, we've kind of gone through this before, that if a parent is found to be neglecting or abusing their child, generally DCS comes in and a case would get filed. In the state of Indiana, it's a child in need of services case. But there's also an informal adjustment process where the formal case isn't filed, or at least the department's willing to work with the family kind of on a probation basis. And from what you shared with us last time is that it used to be the kids that would go through that program, it was something like 40% of them
Yep.
had been removed. Would you share a little bit more about that program and then the incredible stat now through 2020?
Sure. So the informal adjustment um, uh, program or process would be that there was a child in need and had been neglected, and but didn't need to be removed or didn't rise to the level of being established as a child in need of services in the courts. And so there was an agreement that the family would seek out services. What we found was that within 1 year to 2 years after an informal adjustment, 40% of those children ended up getting removed or becoming an actual CHINS case. Now we instituted Indiana Family Preservation Services, and those started June 1st of last year. And with those services, they are intensive, face-to-face services to meet whatever needs the family has with one provider, instead of having different providers that kind of come in and out of the home, which can be extremely overwhelming to families. This one provider makes sure that this family has whatever they need, whether that's substance use treatment, whether it's concrete supports, like I mentioned earlier, whether it's therapy, whether it's learning how parenting skills, helping kids with homework, anything like that. And now what we're seeing is less than 2% of those children are removed after a family completes those family preservation services, which is extremely exciting to me, because that speaks to the overall well-being of children when we take the time to work with their families.
And if I remember correctly, that was something like 4,000 kids in that program, and it went from a 40% removal rate to like less than a 2% approval rate. That's
Correct.
certainly something to celebrate. That's amazing. So I just wanted to point that out to the listeners. I think that as you're working in this space, some Christians, along with the general population, are thinking about DCS and, well, they need to get their act together. Well, I think we need to hear these stats. That's just amazing. You mentioned adoption. And when we were talking, you mentioned a specific age group where if Christians have a heart for adoption, they need to be thinking about a specific age group. Would you share that?
Sure. So we have children that really we struggle with finding them their forever homes, their forever families. Once a child hits 9 years of age, the chances of them getting adopted drop significantly. And the older they get, the more that drops. And so what we end up having is children that work toward aging out of the system and needing extended support from DCS after they turn 18. That's just, it doesn't sit well with me. And when people learn that, it doesn't sit well with them either. And so we really need the church's help in raising awareness that all the kids that we need to find adoptive homes for are not under the age of 5. We have almost 300 children over the age of 9 that do not have an adoptive family identified that need homes. And we're doing some campaigns, social media campaigns, and getting awareness out there, trying to get awareness out there, but we need the church's help to raise awareness. There might be a family sitting in the church that you're looking at right now that can open their hearts and homes and don't even realize that there's a need. So that would be one of my major requests to the church for help.
And we'll share with those links in the show notes. I do have to warn you, listener, if you don't want to adopt one of these kids, don't go on the website. I mean, it's heart-wrenching. Once you see their face, I tell you, it'll pull on your heartstrings. And so I appreciate that, especially as Christians, you're just asking, what can we do? I mean, these kids need a home. And it's not just the 9-month-old, it's 9-year-old into the teenage years. Well, we've shared some of the stats about the turnaround within 2 years, appointed early 2018. Here we are in early 2021. What would you ascribe that turnaround to? Are there any kind of key things that you did or implemented that helped with the change that you could share with listeners?
So I would say I have broad shoulders and thick skin. Doesn't mean I don't have feelings, though. I like to point that out. So I'm always willing to be open and hear the good and the bad. And that's how I started out, was not only going around the state and meeting with everyone as much as I could internally within DCS, but I met as many judges as I could, as many public defenders as I could, anyone that touches the space of child welfare, CASAs as well, and let them know the same message. We have to work together to transform this agency. I don't want to improve DCS. I want to transform DCS, because just improving means being better at what we did before. But I really think we have to do things differently, which is why I think we have improved so drastically over the last 3 years, is that the stats are so remarkable because we've been focused on transformation. Being willing to hear the bad and not being defensive. I have to be able to hear the tough things, or if I don't know about them, we can't fix the issues. But that's how I always approach my work, even before this job, was just really being open and listening more than I speak, and taking responsibility. And sometimes it's a matter of, gosh, nobody wants to take responsibility for that, and whose fault is it? Well, sometimes it's no one's fault, but if I can take responsibility so we can move on to addressing it, then let me take responsibility and let's move on, so that we can make things better for families and for children.
That's really helpful. And I share a T-shirt every once in a while that just simply reads, "Lawyers have feelings too, allegedly." And so maybe we can say that for government officials, public servants. And for the record, that would be 3 years. I went to law school, not a math school, I suppose. But yes, 3 years. Still remarkable changes. If a pastor wanted to jump into this space and wants to be more involved in a local area, would that first step be to reach out to the local DCS office and say hello, try to start building relationships there? Or what would you propose?
That is a great way to start. Every office, almost every county has a local office. And if you don't have a local office in your county, you have one in the neighboring counties. So I believe we only have 2 areas that are affected, or maybe 3 that are affected in that way. Reach out to the local office director. If you go to the state of Indiana website and just search for DCS, you can find all of the local office directors for each office. Just reach out, or just find out where it is, and let them know that you just want to introduce yourself, and let us know what is available. Our local office directors are hungry for community connections, and they are out in the community trying to make those connections. So if you don't know who they are, please don't hesitate to reach out. They would love to hear from you and love to know how they can support your efforts in helping to strengthen communities.
Well, one of the things that I'm hearing today, and as I speak with pastors, a lot of pastors are talking about how they need to build community and how they need to strengthen that in their churches, especially hopefully coming out of the pandemic. And then what you're sharing is what we need to do is go upstream, help build community around these families. So I see there's a lot of synergy right there. So I can't imagine kind of bearing the weight of leading the Department of Child Services with all these different kids in foster care. Also trying to, as you mentioned, not just improve, but transform a state agency. And so I'd just be interested, how do you process that on a daily basis and kind of deal with the nuts and bolts of your job while still pushing DCS forward?
So primarily, it's my faith and relationship in God. That's really what gets me through every day. I believe that the appointment from Him is what led all of this. I never imagined this for a job. I never saw this in my future. But looking back, I can see about all the experiences I've had, personally and professionally, that led up to this. And it's exciting when I get to see God's hand in my life, and it fascinates me still, because it's just me. But that I would say is the primary driver for me. The very close second is my husband. He is a remarkable man who he tells me, prays for me every day. And there are times that he enlists prayer warriors when things are really tough. And so in addition to what I've had the privilege of learning about business operations and doing this job, that's what keeps me going every day.
Well, Director Stidgon, thank you so much for your time. This, I believe, is going to be remarkably helpful to church leaders as they're encouraging their churches to get engaged. And we certainly pray for you, as we're commanded to do, but we're just grateful that you're there at the helm and that you've brought your unique skill set to this and are serving the children here in the state of Indiana. So thanks again for being on.
Thank you so much, Josh. I really appreciate it. Let me know if there's anything else you need.
We will.